Hi, everyone. Thanks for joining. This is Tracy Hopper. I'm the COO of TRIA Health, and I'll be your moderator today. In the essence of time, we're going to go ahead and get started while people join late. But a few housekeeping items. During our webinar, we have all the participants on mute to eliminate the background noise. But if you have questions, please feel free to hit your chat button, and we'll answer those at the end. I'd like to start by thanking everybody for joining us today. TRIA Health offers chronic condition management services to self-insured employers. TRIA, which means free in Latin, represents the coordination of care between the patient, the pharmacist, and the physician. We do this by identifying the 20% of members with chronic conditions that drive the majority of healthcare costs for self-insured employers. We utilize pharmacists to conduct these one-on-one consultations with patients because we know that chronic conditions are managed with medications and pharmacists are the medication experts. Then we coordinate the care with the physician. So TRIA was founded in 2009 to help an employer who was struggling with the cost of diabetes care. Our solution was so successful that over the years, we've added over 20 chronic and specialty conditions. So this webinar will help to provide an overview of why diabetes is a double threat and why it's so important to manage diabetes. Our speaker today is Jessica Lee. She's a pharmacist by trade. She's worked in education and has over 20 years experience in managed care and pharmacy benefits. She's been at the helm of TRIA Health since the beginning. She's very passionate about the role that the pharmacist can play to improve health outcomes, which goes beyond the traditional role of the pharmacist in the retail setting. So with that, I'll turn it over to Jessica.
Thanks, Tracy. Good afternoon. I hope today we can accomplish having some conversation about diabetes and the impact that diabetes has not only to the individual who may be diagnosed with diabetes, but also to the burden that it has on the healthcare system, and particularly as it relates to population health and the costs related to population health. As many of you know, diabetes is a high-cost, high-prevalence condition. Unfortunately, this has been growing over the last 10 to 15 years, and now 1 in 10 Americans is affected by diabetes. And specifically, we know that there are several more, approximately 25%, that are unaware that they are potentially afflicted with diabetes as well. For those individuals who have the burden of diabetes, their risk is higher for morbidity and mortality, unfortunately, and that puts an additional layer of burden on them as well. And cost is just one average point of concern for individuals who have diabetes. You can see here in this chart that the average healthcare spend is 2.3 times higher for the individual who has diabetes. And that translates into a $327 billion problem for those who are aware that they have diabetes. When you talk about the costs related to diabetes, it's more significant than just the utilization costs. There's direct costs and indirect costs. And most of the time, we're all very familiar with the cost of hospitalizations, inpatient care, and the types of services that need to be acquired by someone who has diabetes. But additionally, we know that pharmacy and medication costs continue to be a large portion of the concern. But the other things that impact and affect employers specifically who do provide a lot of insurance for their members is the concern regarding indirect costs. An individual who has diabetes has an increased risk of absenteeism and also reduced productivity due to the secondary complications of their disease. What I'd like to do now is talk a little bit about the different types of diabetes so that we can specifically understand what individuals have to deal with when it comes to diabetes. There are two types of diabetes, type 1 and type 2. Type 1 diabetes affects approximately 5% of the population and is actually a lack of the body producing insulin in one way, shape, or form. Many times this is genetically acquired, but sometimes can be due to some significant event in which the pancreas is no longer able to produce your insulin. Insulin is critical in the uptake of glucose or sugar in the body and allows for all of our organ and systems to work properly. Increasingly with type 1 diabetics, you're seeing that those individuals actually need replacement of insulin, and we have a multitude of agents that now are out there beyond just our insulin products to help individuals who have type 1 diabetes. However, more concerning and more prevalent is type 2 diabetes. Type 2 diabetes affects approximately 95% of individuals who have diabetes, and this is a situation where your body can't process the use of insulin effectively. So there may be insulin available, but there may be an excess of glucose or blood sugar in the blood, and or your body may no longer be able to acquire and use that glucose in a proper manner as well. A lot of times type 2 diabetes is related to diet and exercise or related to weight gain. And a lot of times too with that type 2 diabetes, there's a lot of non-pharmacological things that can be done to help control or reduce the symptoms or even reverse diabetes as well. Globally, these two types of disease states over time lead to long-term complications and a multitude of comorbidities. We'll talk a little bit about that in a minute, but first I want to review what it looks like to be a patient with diabetes. This is a profile of an average diabetic that we work with here at TRIA Health, and you can see that the average age is approximately 55 years old. Now, obviously, this is sort of a profile of a commercially insured population. So when you look at type 1 diabetics, there is an age range that ranges from very young to very old. And type 2 diabetics, it generally tends to be things that occur after adolescence. That being said, in the United States, more and more adolescents are being diagnosed with type 2 diabetes as well. This profile, though, also illustrates the complexity of having diabetes. In our patient population, the individual has approximately 9 prescription medications, and 2 of those are over the counter. So you can see that that's 11 prescriptions in a day that gives them the burden of their disease that they're having to deal with. This is all related to having approximately 3.5 chronic conditions with 7 total conditions that they're trying to treat with either non-pharmacological or pharmacological treatment. They also usually see multiple physicians, which also adds layers of complexity into the individual's ability to handle multiple medications, multiple recommendations, and navigating the healthcare system. These patients definitely have a lot to manage. And if you look to the next slide, we will show a little bit about the complexity of cost as it relates to multiple conditions. 92% of members with diabetes have 2 or more chronic conditions. And those 2 or more chronic conditions, as you add the number of chronic conditions to an individual's profile, multiplies the cost of them significantly. So you can see here in this instance, you can see that if you are a person who has greater than 2 chronic conditions, your cost multipliers go up significantly, such that if you have 5 or more conditions in addition to your diabetes, you're looking at a cost of 12 times the amount of an average member in your health plan. The complexities there, if you look at the types of conditions that people have with diabetes, the most common and frequent is high blood pressure. What we know about diabetes for sure is that the increase of glucose or blood sugar in your blood vessels specifically causes what is, for lack of a better term, sort of corrosion. It's kind of like having a pipe that gets rusted over time with significant amounts of things that may cause it to be caustic. So if you can relate a pipe that's getting rusted on the internal part of the pipe, that's similar to what we have going on with diabetes. Increased amounts of blood sugar that are not being utilized properly causes our tubes or our vessels of our body to have significant impact on their ability for the blood to flow properly. And what happens is that affects any piece of our body that has, or any organ of our body that has significant blood flow. And that's where you'll start to see complications for people who have diabetes as it relates to their blood pressure. They are at increased risk for cardiovascular complications due to high cholesterol challenges as well. And additionally, pain becomes a big issue for them as well. And that's where you'll begin to hear the conversation around diabetic nephropathy. Obviously, you have blood vessels in the extremities of your body as well, in your toes and your fingers. And the same thing can happen in the large vessels that happens in the small vessels. And that's when we start to see nerve damage occur, and you actually begin to see sort of the concerns that people have with blood flow to their toes, which then can lead to amputations and pain significantly for those individuals as well. The other thing that's sort of sometimes forgotten in the mix from a comorbidity perspective with diabetes because of the complications is the mental health concerns. And there's a very high incidence of comorbidity with depression in individuals who have diabetes as well. If we look at the impact that chronic disease has on quality of life, you can imagine why it's overwhelming for individuals, especially upon new diagnosis and as they continue to have progression of the disease if they don't have good control of their disease. It's really critical when we approach helping individuals with diabetes to focus on self-management techniques. Obviously, this is a day-to-day infliction, something that they must think about on a regular basis, mostly due to the fact that what they take in their body and how they move their body greatly affects the way in which glucose is being utilized, and that is a daily occurrence. 57% of adults have attended a self-management class to help impact their quality of life. And it's critical that we continue to give education and information to diabetics so that they can be better stewards of their health. You can see here that these are some of the different complications that we have alluded to thus far. Obviously, cardiovascular disease is of high incidence and comorbidity with diabetes. Additionally, you see vision impairment, potential risk of amputation, and nerve damage, and additionally, chronic kidney disease has a high incidence as well. And if you think about the care path of an individual who has diabetes and you don't have good control over blood sugars, eventually you lead down the path of cardiovascular disease and chronic kidney disease, which, if you are aware of the cost of chronic kidney disease, becomes much more of a burden than in just the diabetes alone. So this is important to help diabetics understand the path that occurs from their disease state and how to prevent getting there. I think one of the things that's probably most overwhelming is that the moment they find out they have diabetes, that's a very overwhelming diagnosis. However, the complications and why you must take action immediately are critically important for them to understand their why at that point in time. We have several care plans that are established by authorities in the treatment of diabetes. The American College of Endocrinology and the American Diabetes Association create clarity around what they believe the standard of care is and how incredibly important it is to follow standard of care for the treatment of diabetes and preventing further complications. However, each of these guidelines is sort of a choose your own adventure perspective. And the key is that a one-size approach for individuals who have diabetes is not the right answer. Generally speaking, the fundamental for starting a conversation around diabetes is to ensure that you take a good look at diet, exercise, and weight loss programs. Generally speaking, with type 2 diabetes, this is where we for sure start. However, as we know with diabetes, medications become a big component of the treatment of diabetes. And you can see, based on some statistics that we have, that 58% of patients with diabetes are controlled with oral medications, and 12% of patients are controlled with insulin alone. There's a percentage of patients, however, that need a combination of medications in order to control their blood sugars to a level which we know helps to prevent further complications in the diabetes progression. The key about this is that you have to actually make sure that each person's care plan is individualized to not only their type of diabetes, but also their lifestyle and quality of life, adding in all of the non-pharmacological things that they may be doing or adding to their plan. Because medications are a huge component of the treatment of diabetes, it's critical that the resources that are helping these individuals navigate the healthcare system are people who are experts in medication. Pharmacists tend to be a high-level resource and highly trusted resource that can help individuals navigate the healthcare system when they get diagnosed with a condition such as diabetes. Something that we do know as well about medication-related problems with diabetes is the inability to achieve goals. This is obviously not a situation that's 100% inflicted on people who have diabetes alone. This is something that happens in the healthcare system together. We know that there's a huge problem related to non-optimized medication use. And what we mean by non-optimized medication use doesn't necessarily have anything to do with adherence, but actually not achieving the goal of whatever you want to achieve for that particular disease state. Specifically with diabetes, we know that we want everyone's blood sugar to be at a certain level in order to ensure that long-term complications don't occur. And unfortunately, what we know is that about 50% of individuals never reach those goals, such as their hemoglobin A1C goals. Sometimes these barriers for compliance are related to medication costs. Employers have increasingly number of people on their health plans that have diabetes. Additionally, the cost for diabetic medications continues to rise. This is definitely a concern across the board for both the individuals who are helping to pay for the premiums and the insurance, but also the individual users. As those high costs get passed to the individual users, many times they're making decisions about what medications they're going to choose to pay for during that course of their month. We've interacted with many patients who have to make a decision between their diabetes medication or their hypertension medication because they simply can't afford both. So 23% of the time, we do encounter individuals who have barriers related to not achieving their goals because they can't afford their medications. Sometimes we find individuals, approximately 15% of the time, who actually truly don't understand the instructions that they've been given. As we can imagine that an average visit with a physician is roughly 7 to 12 minutes. During that 7 to 12 minutes, you will find that you're expected to not only have a good understanding of your disease state and where you're going, but also the medications that are being prescribed to you as well. So a lot of times we find individuals actually confused and have difficulty administering the complicated medication regimens they have been prescribed by their physicians, or simply they don't understand the instructions on how to move forward. A very small percentage of the time, it's truly a forgetfulness or a compliance issue where we can't remember. Good news is, in those instances, we do have aids for allowing individuals to remember how to take their medications. So let's transition a little bit and talk about what you can do from a population perspective for individuals and how we can help individuals who have diabetes better understand their course. Healthcare is very rich with data. We know that data can help us to drive information and decisions regarding how we move forward in many instances. Medical claims, pharmacy claims, and biometric data can help to drive information regarding your utilization of your health plan on how many diabetics are in your plan and how much they're utilizing the healthcare system. But additionally, individuals can utilize data to help drive their decision-making as well. From the patient perspective, you can see that there's a multitude of different devices that are available for them to be able to manage their diabetes. There's blood glucose meters, obviously, that we utilize on a regular basis in diabetics that allows them to understand where they're at the point in time. It's critical to understand what you do with the data that you have. And particularly as it relates to an individual who has a blood glucose meter, it is important to know whether or not that meter gives them the information they need to make a decision or a change. And many times we're looking for trends for individuals, particularly as they first are diagnosed, particularly if you're utilizing something like an insulin product. Insulin products obviously have a risk for causing some symptoms related to what we call low blood sugar or hypoglycemia. Individuals who have type 1 diabetes and are taking insulin products generally are being monitored on a more frequent basis with blood sugar meters so that they can see the trends that happen once they consume a carbohydrate, how the insulin product that they take results in a blood sugar for them to make a decision. That data helps the physicians and their prescribers to make decisions about how to move forward. However, many a times, a type 2 diabetic who initially gets prescribed a oral medication will not necessarily need to test as frequently, mostly because decisions for making determinations on dosage changes for diabetes related to standard of care for type 2 generally don't have a lot of ability to change medication usage based on that result, i.e., if the blood sugar is really high, we'll look at that trend of high blood sugars over time and make decisions at the next physician appointment. Additionally, patients can also utilize fitness tracking apps to be able to track their steps and their exercise, and also be able to track carbohydrate intake that allows them to also make decisions in their daily life for how they move forward. From a business perspective, however, it's really critical to look at how to use the data to identify opportunities for improvement in diabetic care paths. Utilizing data from medical, pharmacy, and biometric information can allow for you to identify members with diabetes to ensure that they're getting the self-management and self-care guidance that they need. Analysis of glucose readings can be made by a clinician over time as well to help that individual navigate the healthcare system as well. So let's transition a little bit to talk a little bit about clinicians and how they are helping individuals with diabetes. We've already discussed that 50% of members who are on medications for diabetes are not able to achieve the optimal outcomes. The multitude of numbers of drugs that are coming out into the market these days with significant differences in their ability to work, their side effects, and how they interact with other disease states makes the complexity even more difficult to understand. Pharmacists, as an expert of medication, are able to and well-equipped to help individuals who have diabetes make decisions regarding what medications would be best for them. It's a cost conversation. It's a conversation around what side effects may be applicable or concerning to you if you take this particular drug based on all of your other disease states and all of your other medications that you may be taking that interact with it. And lastly, it's a conversation about how to make sure that the affordability is there for those medications as well. When we looked at individuals who have diabetes, 35% of them were identified with a drug therapy problem of the dosage was too low, meaning that they were not optimized or maximized on the therapy. Their blood sugars were not achieving goals that were allowing them to prevent progression of disease. There is a portion of individuals who do have difficulty affording medication, which is where a pharmacist resource is highly sought after. That allows individuals, the pharmacists allow that individual to understand the benefit plan and formulary to ensure that not only are they getting the right medication to achieve the outcomes, but they're also choosing the most cost-effective medication for them and their plan. A large amount of time is spent helping people continue to understand instructions and remind themselves of how to properly take medications. It's really critically important that the medications are administered in a right manner and that in those individuals also understand the expectations of what may occur for them as they move forward. All of these reasons are why pharmacists have a unique opportunity to address specific issues in diabetes as they move forward. We had mentioned that a personalized approach is critical to the outcomes of individuals who have diabetes. Every time you interact with an individual who has diabetes, it's really critical that they look at a complete medication review and ensure the understanding of all their medications, all the over-the-counter vitamins and supplements that they may be taking. These all can contribute to high levels of blood sugar as well. There's many a times where we have interactions, drug-to-drug interactions with over-the-counter herbal products and supplements that people have zero recognition and understanding of how that may interact with what they're taking currently for their prescribed diabetes conditions. Additionally, lifestyle modifications has to be a fundamental part of the care plan for individuals. Understanding their current diet, exercise plans, and habits helps them to understand how to move forward. When you begin to have a complete understanding of the medications and lifestyles of these individuals who have diabetes, it's then that you can understand how to help them answer the questions that they may have. A lot of times data doesn't allow you to understand all that you need to understand about how a person is interacting with their medications and their disease states. You must find that from a conversation with them. In addition, preventative services are really critical to moving forward and preventing those long-term complications such as heart disease and chronic kidney disease. In this instance, it's important also to remind individuals who have diabetes that they're doing the regular scheduled hemoglobin A1C checks, foot checks, dental exams, eye exams. All of the things are allowing a clinician to look into whether or not they're seeing progression of the disease state, in addition to understanding where their blood sugars are at that time. Coordinating all of this for the patient with the physician is critical, and pharmacists are a unique resource to allow for that coordination specifically. Let's go over a few examples of instances where the conversation with a patient was allowed to reveal a situation where we could resolve a problem for an individual and improve outcomes. This is an example of an individual who had 6 prescription medications, 1 over-the-counter med, with 3 physicians and 4 other chronic conditions. As you can see, the complications of diabetes, coronary artery disease, depression, and benign prostatic hyperplasia were afflicting this individual who was managing their diabetes with a combination of metformin and Novolog, an insulin product. With that combination of medications, with 2 medications for diabetes specifically, the hemoglobin A1C goal was still at 8.3. Obviously, generally speaking, because everybody has an individual goal, your goal is to try to get the hemoglobin A1C around 7. So for this individual, having a 1.3 increased percentage of hemoglobin A1C was putting them at risk for long-term complications, as we have discussed. In the discussion with this individual, we found out that they had a side effect related to some of their medications, particularly metformin. Additionally, if you would have approached the care regimen by increasing the insulin, that could potentially, unfortunately, have a side effect of weight gain. In this instance, in order to ensure that you're maximizing and optimizing medications and outcomes, it was decided with the physician's help that it would be best to approach increasing the metformin to a more tolerable dosage form, which would allow the patient to not have the gastrointestinal side effects. Additionally, those GI side effects tend to resolve on their own after 1 to 2 weeks. This allowed the member to not have to increase the insulin amount, which could have led to an increased weight gain, which would have also contributed to potentially worsening blood sugar levels for this individual. This would not have been found necessarily through information from data, but through the engagement with the patient to understand how they were interacting with their medications at the time. Upon follow-up with the maximized regimen of the max dose of metformin, plus the ER dosage being at a tolerable level for that individual, we were allowed to see that hemoglobin A1C had dropped by 1%, putting them at goal and a tolerable way to control their blood sugars as well. Another example that we wanted to share with you is an individual who had, once again, multiple medications, multiple chronic conditions. As you can see in this instance, this individual also had peripheral neuropathy, which is a complication that shows that blood sugars have been elevated for some time in this individual. Despite having a really good control of their drug at 6.1% for their hemoglobin A1C level. They were taking a 3-medication regimen, which can be complicated, but what they found was that the member was experiencing significant low blood sugar episodes, primarily in the morning. Low blood sugar episodes not only put you at a risk for concerns regarding mental status changes, but also puts you at risk for having episodes of fainting and potentially falling. Upon discussion with the member and the physician, it was recognized that the use of the product glipizide can significantly contribute to hypoglycemia. The other two medications don't necessarily contribute to those particular side effects as correlated directly. Significantly, by reducing that glipizide dose to once daily rather than twice daily, the member was able to not have hypoglycemia in the morning, which then allowed for them to be still in control of their diabetes without significant side effects. Not only are we talking about the risk of concern to acute mental status and seizures, but really from an individual's perspective, if you've ever experienced low blood sugar, it causes you to have a really horrible feeling, and that really affects quality of life. So I think it's critical to think about that from the personalized effect. Not only were we able to help this individual tolerate their medications better, but we were able to also help reduce medication and pill burden load for this individual. Overall, if you look at maximizing and optimizing medication regimens, you will find that you will be able to decrease cost and utilization related to the cost of treatment of diabetes for individuals. This study here shows an impact of an intervention using pharmacists to interact with individuals who have a diagnosis of diabetes. In this instance, the pharmacists are also certified diabetic educators, so there's significant training around the treatment of diabetes. If you look at the cost of poor outcomes with diabetes, and we've referenced them already, obviously seeing that diabetes untreated long-term can lead to cardiovascular complications, it can lead to kidney disease, it can lead to an increase of infection and risk of infection. And you look at those cost of poor outcomes for people who are engaged with a pharmacist versus those who are not engaged. You can see the impact of the cost of poor outcomes over a time frame of a year shows a significant decrease in cost of about $3,000 for individuals who are engaged with a pharmacist on a regular basis. If you look at the other comorbidities as well, you can see that there's also continued significant impact by optimizing medications, ensuring appropriate, safe medication use for all the individuals and all the disease states they have. You will have a cost reduction in utilization, not only from a medical side, from a pharmacy perspective as well. It's really important to think about the impact that a pharmacist may have based on their ability to focus on the patient as a whole rather than looking at a prescription-based approach. If you look at the pharmacists in the healthcare system, it's critical that we remember that pharmacists are capable of being a part of a multidisciplinary approach and team with an individual who has chronic disease. Unfortunately, in the dispensing model of pharmacy, it takes an approach of a prescription-based approach, meaning the pharmacist gives impact and feedback based on the prescription that's being dispensed and prescribed at the time, rather than taking a personalized, focused approach, which looks at the individual as a person and a whole and all of the diseases and conditions they have as it relates to their quality of life. This approach allows for better impact on cost and utilization, as evidenced by one of these studies and additional many other studies that are out in the literature supporting the pharmaceutical approach of pharmacists in the treatment of members who have chronic disease such as diabetes. Finally, as we wrap up, I think it's critical to remember that diabetes is a high prevalence, high cost disease. The majority of patients who have chronic disease have other conditions as well, which is why an approach to the whole person is critical to ensuring outcomes of all the disease states they have. If over half of the diabetic patients aren't meeting their optimized goal or their hemoglobin A1C levels, we still have a long way to go to ensure in helping these individuals navigate the healthcare system in a way that allows for them to help not only achieve a better quality of life, but lower costs and lower utilization, including decreasing impact on preventable disease states by ensuring that their blood sugars are controlled. In a model like TRIA Health, where we utilize pharmacists in conjunction with their physicians and the patients to ensure and drive outcomes, we are able to see and experience savings per patient of about $2,300. This is clearly something that is both impactful at the cost level, but also the patient acceptance level. Utilizing data and technology, in addition to a personalized approach, allows for better condition management and better health outcomes, which then leads to lower healthcare utilization and costs. With this combination, clearly you can achieve better outcomes for your diabetic patients and ensure that they are living the quality of life that they expect to live based on a burdensome disease that can cause them a lot of pain, agony, and cost. I appreciate your time today, and for that, we'll end with a few questions.
Thanks, Jess. So one of the questions we had a couple of questions that came in that I think got answered during the course of the presentation, but one of the questions that came in was, what percent of type 2 diabetics would not have diabetes if their weight were at an optimal level?
Well, I don't have an exact percentage, but I would suggest that if you're at an ideal body weight, the amount of blood sugar in your blood would likely be reduced globally, and your ability to have your insulin receptors respond to the blood sugar in your blood would be better. So therefore, a lot of times you're going to see some reversal of type 2 diabetes by just reducing your weight to an ideal body weight. I think that's the biggest challenge for individuals with type 2 diabetes, is to focus on diet and exercise. The problem is that a diet and exercise journey is sometimes a long journey. And so we will start medications after a 3-month trial with a non-pharmacological approach. And what they should continue to do is fight getting a medication to help sort of immediately reduce the risk of the long-term complications. It's also work on continuing to reduce weight over time, because that's really the sort of big guns for treatment of type 2 diabetes.
Great. So if there are other questions, you can enter your question by hitting the chat box on the GoToMeeting. We did have a question related to pain as a comorbidity for diabetics. So we know, based on the presentation, that over half of the people that suffer from diabetes also suffer from pain. Do you want to elaborate on that?
So I think what I hope to emphasize is, a lot of times pain in diabetics is resulting from the diabetic neuropathy that we were referencing earlier, which is nerve pain in the extremities, mostly caused by long-term blood sugar in the capillaries, which are your small veins in the extremities. That nerve pain is a very painful, strong, pulsating type of pain that's burning, and it doesn't go away. So the challenge is that once that neuropathy has occurred, it's not necessarily per se reversible. So you have to treat pain differently with nerve pain medications, and there are a multitude of them out there. This is not a pain that's like any type of an opioid need type of pain, but more of a nerve pain where we use specific drugs to treat that. Obviously, other pain can occur, especially if you have an amputee. You'll have those types of pains. And individuals who have type 2 diabetes and are obese will also have chronic pain related to osteoarthritis and things as well, back pain and neck pain. But generally speaking, a lot of the pain that we're talking with patients about has to do with pain that's occurred due to the progression of their diabetes, and so specifically dealing with the nerve pain or neuropathy.
Great. So another question that came in is, how do we get employees to engage with TRIA Health?
Well, one of the keys to engagement is obviously communication. And it's really critical and important to help individuals understand that a pharmacist can really help them, not only from a management of all of their medications, but also help them with cost related to medications as well. So there's one layer of ensuring the education and understanding of what a pharmacist can do, and the fact that having a pharmacist 100% dedicated to only answering your questions is critical. Additionally, though, we have extensive experience in providing incentives to individuals to engage. And those can be in a multitude of ways that we exhibit those incentives. Sometimes it's a reduction in the copays of the medication specifically related to diabetes, contingent upon engagement with a pharmacist. That sometimes will help the burden, particularly if you have a plan that the cost share for the member is extremely high. Ensuring that you're not just giving the drugs away for free, but sort of providing resources around that is helpful as well. And then we also do other things like provide gift cards or other types of incentives around wellness plans that will allow an incentive for an individual to engage with the pharmacist as well.
Okay, great. Thank you for that. I think that covers our questions. If you have questions after the webinar, please feel free to send them over to us and we'll get those answered. As I mentioned at the beginning of the webinar, it is recorded, and so we will make the link available to those of you who would be interested in hearing the recording. And with that, we will sign off and give you 15 minutes back. Thanks so much for joining us today, and we hope you learned something. Thanks.